He has authored and presented numerous papers, contributed to high-impact journals, and is recognized for his expertise in laser-assisted dentistry. With a career dedicated to innovation and advancing treatment protocols, he continues to be a pioneer in his field. So let us welcome Dr. Sunil.
The topic of Dr. Sunil's presentation is the Alumini Meet Revolutionizing Dentistry with Lasers.
Good evening, one and all. At the outset, let me thank the organizing committee, ma'am, Shishir sir, Aditya, my batchmate, and the rest of the faculty for inviting me. I consider it an honor and a privilege to be back in my alma mater to give a presentation. Let me first pay my respects to an exemplary teacher and an inspiration to all of us. Let's enlighten dentistry with lasers. I'm Dr. Sunil Mirali. Let's move in fast. Mine is a more clinically oriented presentation. Lasers help in diagnosis. It is a more or less painless or a mild pain procedure. The most advantages of laser is it gives a bloodless field. It's minimally invasive and it is bactericidal. You need lesser antibiotics and recovery is much faster. In a normal routine clinic, you either use loop or you work with a microscope. But when it comes to laser, it makes your practice more sophisticated and thereby it adds more impact to your practice. Laser has application in all fields of dentistry. I will be explaining each one in short. The low-level laser therapy, as explained by Dr. Sakib, or photobiomodulation, as it's called now, has phenomenal importance in clinical science nowadays. Just a brief on what are the types of lasers. These are the soft tissue lasers, and that is the hard tissue laser. They have various applications, but in dentistry, we primarily use the diode laser. The diode laser has a wavelength of 810 to 980 nanometers. Laser acts on the tissue in 4 different ways. It either gets reflected, it gets absorbed, causing ablation, it gets transmitted or scattered into the system. It is either used in contact or non-contact mode. The most important factor here is that the deep tissue gets hypereme or gets stimulated, causes stimulation of the deeper tissue. So when it's used in a non-contact mode, it causes a photobiomodulation or enhances healing. Low-level laser therapy has already been detailedly explained by Dr. Sakib, so I'll go more into the clinical aspects. In endodontics, it's got various uses, especially the diagnodent and the laser Doppler formometry for diagnosis in conservative dentistry and endodontics. Moving on to dentine hypersensitivity, laser helps occlude the dentinal tubules and enhance or rather reduce hypersensitivity. This next case that I'm presenting is of extreme importance for me because of the case I got an invitation to the World Congress on Oral Lasers. This patient came to me with a grade 2 mobile tooth with severe bone loss. Now, I had treated her son for a 6-year-old child who had grade 2 mobility on one of his molars, deciduous molars. But deciduous molars, like you know, most periodontists know, it heals much faster and the mobility comes down. But in this case, I was seriously thinking of removing the tooth because there was plenty amount of bone loss, both interdentally and around the root. So we started with endo, and she didn't turn up for another 8 months. And 8 months later, she comes with a fractured filling. I thought, okay, we'll throw it off. But when I took a radiograph, I saw a lot of bone formation there. So at this stage, we had done what is called as close reduction, and we did a LANAP technique, which I'll be detailing you later, wherein along with the endodontic procedure, we cleaned the periodontal tissues as well. And this case has a 10-year follow-up. It's still working well for the patient. She came in for a restoration of 6, but then this was, I'm pretty happy that this survived such a long time. I wasn't expecting so. So from here to here, it's basically reached because of proper protocols and use of lasers to enhance or hasten the treatment strategy. How is laser used in endodontics? Just a small video. You take the laser right 1 mm short of the working length from the apex. Move it in circular motion, clockwise or anti-clockwise, 2 mm per second once you activate it. Once you activate the laser, then you immediately start to move it. Take it back, rotate it, and slowly take it out. So this enhances the penetration of the bacteria within the tubules gets cleared once you've done this. This will enhance your activations of the irrigant as well as cause bactericidal effects. Laser, as you know, like with the pointer, it goes in only in one direction. So particularly for endodontics, they've introduced this lateral firing trips, which causes laser to be emitted both through the sides as well as to the center. This is particularly for endodontics. This is yet another case, large periapical lesion. When we did a vitality test, 1 was vital. He had already undergone endodontics and he didn't follow up, and he came to me with a large lesion. We did a vitality test of 2-1, and that 2-2 that was vital, but 1-1 was not vital. So we decided to do endo only of one tooth and not both. Seeing the lesion extending right into the lateral as well. I had two minds because it's a private practice that I have. Generally, in such cases, ideally better to do endo in both. But since the 2-1 was vital, 2-2 was vital, we thought we'll try and save it. Post-op, unfortunately, this case was, the post-op of this was around 2 or 3 years later. My laptop got damaged and I lost all the cases. The obstetrician immediate post-op is missing. He started orthodontics later in our own clinic, our own practice, and he had an accident and came with one of the brackets broken. That's when we took this radiograph later, which shows excellent healing. 2-2 is still vital and still going on. The problem with the endodontics or a pulse space, like Dr. Sagib explained, it's a very complex anatomy. There's a lot of lateral canals. To get in through those and to clear those is extremely difficult. But with proper irrigation protocols, proper activation of irrigants, which will be detailed later in one of the lectures by Dr. Monica, and with lasers, you get excellent fills. You get lateral fills. You get apical delta fills. You get a lot of these anatomies that get filled because of the proper irrigation and cleansing of these blocked areas. Yet another case. This is a pre-op. This patient was done by an endodontist. It's one of my classmates' wife. He practices in Qatar and he's a maxillofacial surgeon. So he sends me this radiograph asking me if I could do something on the 6. There's too much of loss of crown structure, and him being a maxillofacial surgeon, and there's a failing endo. I asked him to extract and put an implant there. But then he sends me a message saying that his wife and she's flying down to Kerala the next day and wanted me to treat. And we opened it up, did proper debridement. We could get 3 openings in the apex. It's still functioning for the last 3 years. Next, we move on to the restorative dentistry. Once we do deep crown prep, subgingival especially, we got a lot of bleed. And it's extremely difficult to get your margins proper, especially if you have a scan. The impression might push the blood and you might get a pretty decent margin, but to get a proper impression with the scan is a big headache. And you send to the lab person will have a tough time to isolate the margin and give you a good crown. But with lasers, you can roughen the margins. Opening it up, it's bloodless. So what happens when you scan and we take your impressions, you get much more cleaner images on the scan, and your lab technician is extremely happy because he can see all the margins and he can prepare you an excellent crown which will last a lifetime. So from here to here, you can see all the margins clearly, and that will enhance your it gives you long-standing procedures and long-standing lesions. A class 5 lesion, it's a bit subgingival, so we remove the decay, isolate. There's a little bit of tissue hanging up, so we lace that, just that area, not the whole thing, and restore. Some patients are economically down, so I mean, although I suggested a composite, he wanted a glass ionomer, we did a glass ionomer. The aesthetics is not good, but it's a lower premolar and it's not much of an aesthetic issue. Post-op, immediate post-op, this will heal within a week, so it's good. And the restoration will last well because it's properly isolated and free from any side of exudate. It gives you confidence to do deep restorations, minimal preparation and minimal, you get good margins and your restoration seal and seed goes very well. Here there's a lower 4-6 with a very deep restoration, very deep secondary caries under a restoration. He was advised endo by many other clinics. He came to me, I thought we'll try pulp capping. We removed the restoration, removed the decay completely, placed a little bit of MTA there and restored it with composite. I just have a 3 months, this is done around 3 months back. He's just completed his 12th, he's gone for his higher studies in Bombay. Once he's back, I'll get a follow-up radiograph. Other use of lasers include in whitening. Now in whitening, many times you get a lot of other activation modes. Laser is only one of them. It works well. Moving on to perio, laser depigmentation is, you can depigment with scalpels, you can depigment with cautery, but the advantage with laser is that the deeper layers get, the low level therapy helps healing better and gets much better results. It's a short video on the same, how to do laser depigmentation. The dark areas are removed with the laser. This is a diode laser that is using, 90% of the practices have diode lasers. The hard tissue lasers are really expensive, excellent, but it's really expensive, more than 30 lakhs. This is immediate post-op after lacing. And when we do a low-level laser therapy, we do photobiomodulation soon after the procedure. That is to enhance healing. It also reduces inflammation and pain post-operatively. I'll show that in a video after this. It's a short video. You hold it in non-contact mode and you activate the laser. This is a particular type. It looks like those LED curing lights. And it's held out of focus after you do the depigmentation, and it helps reduce pain post-operatively and helps healing. LANAP or laser-assisted new attachment procedure or laser-assisted regeneration. I'll show a small video before I explain the procedure. It's an animated video. You first create a space with the laser, opening up the sulcus, go deep inside, and then you cleanse or sterilize the area. First you sterilize the gingival area, 2/3 of that. When you go back, it will kill the bacteria. It's bactericidal, as you know. Then we clean the surface of the tooth, root planing, deep scaling. Once it's debrided, you go back with the laser, complete the procedure, right through the sulcus. And that helps healing. It causes, it enhances coagulation as well as healing. I hope it was clear. Do you want me to explain it further again? The same thing in pictures, yes? Other applications in periodontics includes decontamination of the peri-implantitis. When once it's developed, you open up the space. This is photo-activated disinfection, and then you place a graft. It heals well. Also, closed pocket sterilization is another use of lasers. In orthodontics, it is said to enhance treatment time or reduce treatment time by 40%. Also, in cases like this, when there's gingival coverage, you can use the laser, remove the tissue, and attach the orthodontic bracket. There's plenty of use in surgery. I don't want to go deep because I have very restricted time. Together, let's enlighten dentistry. It looks much more brighter with the lights, right? But the important factor is that the basic protocols that has to be followed. There's no compromise on that. And my department, my clinic rather, my assistants look much happier when we're releasing. Yeah. Thank you.
Wow, super. That's fine. Okay. Thank you. Thank you, Dr. Sunil, for a very illuminating presentation on how lasers are reshaping dental protocols. Thank you. Any questions? Okay, so let's move on to the next speaker.